Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
3-day period in which you did nothing. You turned off your telephone, turned off your cell phones. Do you think you could survive 3 days of that? How about one day, 2 days, 3 days?
Yeah, I can. I'm not glued. I can.
I can't.
I
I'm
can.
sorry, Janice, you're stronger than me.
I can.
I would have to use the landline.
As long as I have the telephone, I can.
Well,
But
we went telephone free.
I know, same thing.
I can.
Mhm.
How many days?
3. They went 3 days.
3 days.
I
Yeah.
can.
They
I
found out that
can.
life went on without them for 3 days,
Yeah.
With a cell phone?
without a cell phone or phone,
A cell phone and a land phone, or just a cell phone?
Oh.
without either.
Oh.
Okay, Janice, can you go 3 days without any type of phone?
No, I can't. That's what got me through the snow days. So I'm not used to living by myself, so the phone was my partner. So I was on the phone a lot. So no, got to be able to communicate.
Yeah,
So
that's what they
Dr.
said.
Callender, can you live 3 days without a phone?
3 days, it would be, I can't imagine one day without a phone.
Right.
That's 3 days. But that's because so used to communicating with patients as well as others, you know, and you kind of get conditioned. But
Mhm.
they went cold turkey for 3 days, and then when they turned their phones back on, life went on without them. And
Mhm.
shockingly,
Yes.
yeah, they had maybe hundreds of emails and texts, but yeah. So, but anyway, it's food for thought that how will your family do without you for communicating with them for 24 hours, 48 hours, or 72 hours? And is it healthy for you or healthy for them? Or
Mhm.
uh, those of us who have a lot of families,
Yeah.
uh, you wonder, you wonder.
Mhm.
It's easy to say. I don't know anybody who's actually tried it though, other than this group that actually did it
Yeah.
for 3 days. Yeah. Well,
Many decades ago, the New York Times, I remember a poll that they had, and what they did was people could not communicate or had no human connection for a week. They
wow.
had to have everything delivered. They had to work and communicate everything within their homes. And we were astonished
Mhm.
that a human could go for an entire week without other human contact. But now, Grubhub, you can get everything delivered. Many people go weeks without human contact.
That's interesting. Yeah.
Yeah.
Uh, Darryl?
When I used to when I used to do mountaineering, it's typically a 3-day expedition where you couldn't get cell phone reception. So that was 3 days without a cell phone.
Oh,
How was it?
Uh, it's it's similar to meditation, and that's because on an expedition, you have to be single focus, and you can't let your mind wander because if you get distracted, could be fatal. So your mind really calms down, um, but uh, it's so amazing up there because like the colors are brighter, and just looking down or up, like walking through clouds. Um, that I can see why Native Americans spend so much time in the mountains because it's just such a wonderful experience up there.
Carol?
I remember Darryl telling me about climbing the mountains, and once he took his wife up there. Have you ever thought about what you do when you have to go to the restroom on the mountain?
You're asking me?
Yeah, Darryl told me what you have to do when you're on the mountain, have to go to the bathroom.
Okay. Uh, well, uh, when you're above the tree line, which is trees stop growing at about 8,000 feet. And so then you have the alpine grasses. Above the tree line, nothing ever deteriorates. And so if you defecate on the mountain, it stays there forever. So the idea is that um, you have these pack out bags, latrine shovels. And so you put it in a bag, put it in your backpack. Uh, and when you get off the mountain, you deposit it, but you don't leave anything on the mountain. As far as like urination, that's not a problem. But yeah, you don't leave any waste matter on the mountain.
mm,
That's interesting.
yeah.
Wow. Well, it's interesting to hear what people will do with meditation and how uh, often the meditation, as they talked about meditation, some of them fell asleep during meditation and the other things. But it sounded like it was a beneficial 3 days. Uh, those who enjoyed it. So,
Mm,
and meditation, of course, is always helpful, uh, regardless of what type of meditation you decide to indulge in.
mm.
Okay, if there aren't any other comments, I guess we can start
I
with the
just
audience.
have one, Dr. Callender, you were talking about deprivation of human contact for a week. What does that do to you mentally or physically with no human contact for a week?
Uh, I think for many people that's called isolation, and for many people that's uh, not as healthy. Uh, and some think that this may be one of the reasons why we have so much violence one to another because we don't have the common human contact, which I think is necessary. Uh, but when people talk about why people today rarely communicate one-on-one other than cell phones, and they don't go face to face. They think that that's pathological, and it's often associated with mental health issues. Uh, so human contact is important. Uh, and social isolation is considered as unhealthy.
Okay, since my husband passed, I don't know, Janice, if you experienced that. Well, then my children said they put a tracking device on my phone to keep track of me.
Mhm.
I don't know if
Yes.
anybody else experienced that. That's a new part of my life that I got to get used to. I haven't been tracked all these years, and then all of a sudden they got to track me.
All of a sudden, you got that right. Where you been? How long you gonna be? I've been
I
sitting here waiting for you.
I know all this
Mhm.
whole time. I don't know if they did Dr. Callender that way when he lost his wife. But
Yeah.
then my children come up out of the woodwork, how are
Hmm.
you? Let me track you. And then they say, well, where are you? I said, well, you got me on your phone. Should know
Hmm.
where I am. But
Yeah. Absolutely. Yes.
Yeah, well, my
Hmm.
three children are,
Hmm.
yeah, they have to contact me once a day,
Oh yeah.
they think. So,
Hmm.
What a
uh,
blessing. What a blessing.
Hmm.
yeah,
yeah,
it's a new world.
yeah, yeah, yeah,
You'll get
yeah.
used to it.
Oh, yeah, yeah,
Yeah.
yeah,
Yeah.
yeah.
Hmm.
But as Carol said, it's moment by moment.
Hmm.
Although wasn't, I wasn't aware of anybody trying to track me down, but well,
Hmm.
at least they didn't tell me. So, uh,
Yeah. Mhm.
why did they tell you? How did you know they were trying to track you?
Because he took my phone and said he wanted to track me. And
Right.
like they track their kids know where they are, and they tracking their children. It's a new
Hmm.
thing. So he put it, and I said, okay, you can do it, but it doesn't stop me from going where I want to go. So
Then they start coming in all hours of the day and night. You can be in
yeah,
bed. Who's
uh-huh.
that? What's that?
And they walking
It's
in
me,
your
Grandpa.
house,
It's me, Mom, in
right?
and out. Yeah.
Uh, okay. All right. I guess we can start now. Got a nice group assembled this morning. Had some interesting articles to share. This is one of the most interesting articles is the next generation vaccines is, as you now know, the CDC rejected the opportunity to review an application for new mRNA technology. And of course, that caused a furor. And in today's paper, it indicated that they had reversed their position, were willing to look at the new mRNA technology, which has many benefits over the old technology, especially as it relates to vaccines. But in every single way, it's uh, far superior to the DNA technology. And the thing that makes it so different is that with the other technology, they had to use uh, they had to use viruses and other things, which uh, increase the possibility of you actually getting the virus that you're being vaccinated to prevent from. But with the new mRNA technology, it's faster and they don't use viruses at all. So it's not possible for you to get a infection from the vaccine. Uh, so the only thing about it is that it is more expensive, but it's a necessary advancement that must be entertained because it's progress. And as we make scientific advances, we can't just lag behind and do DNA because we don't like the RNA technology. And so in this morning's Washington Post, they talk about the fact that they have relented and decided that they would look into the mRNA technology, which is superior actually to the previous vaccine technologies. And I think, as I mentioned, the one thing that is different is it is more expensive. But it's been used for autoimmune diseases, for diagnosis of cancer and other areas, and there's probably no area where it cannot be helpful. Uh, so, so whether Kennedy likes it or not, whether the Republican administration likes it or not, this is something that we really have to keep up with. John Buchanan?
Yes, one of the fears with using genetic treatments like this would be like we had with the cloning of the sheep way back when. A lot of fear of what could happen as we dabble with the genetic code. So, the success that we've had with COVID and other viruses using the messenger RNA technology is so fantastic. It has quelled a lot of that fear of cloning another Donald Trump or another Adolf Hitler. But one of the big deals with messenger RNA technology is the immune system. And Dr. Atto and I were studying immunology over the NIH. That was 20 years ago. So it's continued to develop, and all the greatest minds in the world have been looking at this for a long time. Thanks.
Thank you for sharing. Any other comments? Because it's an idea whose time has come, and because it wasn't our idea, it doesn't mean that we have to be blind to progress. And we're just hurting ourselves. Uh, so this is a very timely article that at least one of the things that I'm pleased to notice in the newspapers almost daily is that the protestations are being heard, and the Republican administration is changing their behavior. And I think that this is a good thing. I think it reminds me of what Darryl had said some time ago, that these protests, although what happened in Iran is an exception to the rule, when they killed everybody who protested there. But protestations still make a difference. And so even here in this country with our administration, which has tried to be deaf to it, the protestations have made a difference. And I'm hopeful that they will continue to make a difference, particularly as election time rolls around. Any other comments?
Question 4 talks about that, can messenger RNA alter a person's DNA? So it says no, it does not. So that gets rid of the fear of cloning a person using this technology. They have other technologies, but this one is relatively relatively safe. And then you got to worry also about AI taking over and creating uh, copies of humans uh, in the future. I think that's if you look at the Terminator.
Yeah,
So
yeah,
those
yeah. And
things
that
to
also
think about.
was many people's great fear that AI would eventually turn on us, just as you mentioned the Terminator. Lucy.
I think it's really important with this conversation, given what this present administration has done with diversity, equity, and inclusion nationally, that we be at the table as we move forward. Because inclusion in research is critical. And the damage that has already been done in terms of excluding diverse populations, we have to be ever aggressive advocates for our inclusion in research.
Well, and I think it's a good sign that HHS has reversed its positions on many of these positions because of the protestations. And although even Trump spoke out about the fact that in Iran, the protestations resulted in them killing the protesters. It's not something that is acceptable here in the United States, and the people who were killed in protests, it has caused a backlash that is still being felt. So, so we have to continue to protest, but there is a price that you have to pay for protesting. But the greatest price is the price you pay when you let people like Hitler and other Hitler-like persons take control and quietly sit by as they destroy our reasons for living.
As they killed protesters here in the US of A.
Yeah, that's what I said. And we've had, we've had a couple of people killed here in the U.S. of A., but they had hundreds and maybe even thousands killed in Iran. Okay, well, I think this is an article that was very provocative and very appropriate, very timely. So, yeah, let's go to the next one. It's interesting. We decided we're not going to participate with WHO, and now we're going to sit in on the meeting as they talk about the influenza vaccine composition. After we said we're not going to pay any more dues and we're not going to participate, we realized that we're being left out and people are moving on without us. And so we're going to become involved anyway. And I think it's important because we make a mistake in not recognizing that this is a global period now in which all countries have to look out for each other. And we just had a pandemic which involved the entire globe. So why should we now suddenly decide that we are going to be a standalone group? So, but what is good about it? The WHO is going to allow us to participate, so that's positive. Any other comments about the interesting decision of the United States to participate in the WHO scientific discussions?
Yes, Dr. Callender, is there, do you understand about the complaint about the hepatitis B vaccine?
What they're saying is that certain places, okay, uh, United States made a statement that they don't want to give the vaccine at the time of birth. Um, most countries do that, but this country doesn't do that they're talking about here. And so uh, they felt that if you had a research that left out giving hepatitis B vaccine to the newborn, that it would be unethical because it has been shown to be helpful. But this particular country they're talking about doesn't use uh, hepatitis B vaccine to the newborns. So that therefore it would not be unethical there. It would be unethical in other countries, but not in that particular country. But that's the point that they're making about it being unethical in certain locations. Because we kind of think we know better, and that since we know that hepatitis B vaccine is good for the newborn, and why would you not administer it? And that's what they were calling unethical. Did you understand what I was saying?
Yes, now I do. Thank you. Yeah. So that they're saying that testing it would mean not giving it to some children,
Right,
and
right.
it would endanger their lives. That's pretty bad.
Yeah, that's right. Well, what an interesting world we're living in where uh, the truth becomes the lie and the lie becomes the truth. It's a strange world we live in. So you have to be careful what you do because sometimes what we know as truth is not recognized as such. For example, we know that there's no black race, but yet this country continues to do things based on race when we know there's only one race, the Homo sapiens race, and that we have different ethnicities, but still we try to make the lie the truth and the truth the lie. Wow. Okay. Any other comments? If not, this article has noticed that certain product, moringa powder capsules, uh, have been associated with drug-resistant salmonella infections, and they've identified that in a number of states, and they've stopped the administration of this particular substance. Uh, and so uh, I'm not familiar with that substance, the capsules, but they are trying to get everybody to return them because salmonella, which is drug resistant, can be fatal. I don't know where the moringa test powder is provided, but that's the area that we're talking about. Somebody have a question or comment?
No, they were just unmuted.
Oh, okay. All right. Okay. So this is a rare phenomenon that has occurred, and hopefully it will be contained and eliminated. Now, this is an article that is very disturbing, but then um, our abuses to the tribal nations are just unending. And we know that one of Trump's biggest battles is to eliminate Obamacare, uh, but it will have a devastating effect upon the Native American population. And this article is emphasizing that this year, uh, this will have devastating effects upon the Native American population of the United States, as well on the people of color in the United States who have had Obamacare and want to continue Obamacare. But the battle goes on, and that's part of the reason why we had the shutdowns in the first place, and the partial shutdowns as well. And that's what what our battle is about. And of course, it didn't help to have Trump having pictures of the Obamas as apes, which is just unbelievable that somebody would be like that, who is our president. But anyway, that's where we're living today, with no apologies as well. Right. He did it, and he's proud. So what can you say? So while this article is on the Native American population, it has its ramifications on other groups. It's just that uh, this is one of the first groups that will pay the price. Eventually, the poor white population will pay as big a price as anybody else. Any other comments on Obamacare, and the Trump anti-Obamacare policies? I'm not making this stuff up. This is real. Sometimes you want to believe it's made up, but it's not. I think it's enough that Columbus did, but now we're continuing the tribal warfare. Okay, any comments? If not, we'll move on to the next article. Yeah, this is an article that temporarily blocks the White House block to stop CDC funds in California, Colorado, Illinois, and Minnesota. But this is just a temporary block. I don't know what's going to happen in the long run. But it's interesting how the CDC will block only certain areas that are anti-Trump. And it's kind of sad that we have a country like this, but this is what we are faced with.
Those are blue states, right?
Yeah. Yeah, states that didn't support Trump. Yeah. Kind of petty, isn't it?
Well, I think the gerrymandering is also the same idea. We're
Yeah.
gonna make sure that the Republicans can stay in power any kind of way they can. So, cutting the grants is going to kill a lot of kill a lot of Democrats.
Mm. Sad, sad, sad commentary. Okay, let's go to the next article then. This is a positive article for a change, but this is something that talks about that low fat or low carb either is good for reduction of heart disease. Uh, and what you eat is so important, particularly as it relates to cardiovascular disease, which is the number one killer in the United States and the globe. And so changing your diet to have a low fat, low carb uh, will perhaps save your life and decrease the likelihood of coronary artery disease, which is the number one killer in the United States and the world. None of this is new, but it's just sharing the importance of what you eat, emphasizing the importance of nuts and fruits and vegetables.
Dr. Callender, do you agree with this new pyramid they're talking about? It's upside down. What's up with it?
Well, its emphasis on the vegetable and fruits and dairy is, I think there's evidence that it reduces heart disease. That's what makes it desirable. And the numbers that they have, they're talking about people in the number 20 and 10 to 20,000 people in their studies. So it does seem to make sense. The data supports what they are saying. Well, it seems as though most of the studies are supporting the fact that sticking with fruits and vegetables and plant-based diets are the healthiest way to go. And all of the data seems to support that. The data is very impressive. So, then, of course, the combination of a good diet and exercise and uh, weight resistance exercises, aerobic along with weightlifting, uh, all of those things promote a healthy lifestyle, which is beneficial in every way in terms of decreasing the likelihood of dementia as well as uh, other other diseases, decreasing the likelihood of other diseases, other inflammatory diseases. This along, of course, we don't talk enough perhaps about the importance of keeping your cholesterol low as along with everything else. They're even now talking about a new treatment for cholesterol where you actually give an IV infusion of a gene splitting uh, molecule that will reduce the cholesterol once and for all. That's something that they're researching on, so that's still not done yet. But there's data that suggests that that's something else when we talk about the gene editing technologies, and uh, we may soon have one that allows you to lower your cholesterol just by taking a gene editing intravenous administration. But so all of these things have a, but I think probably none of them are any more important than taking your medication and keeping your blood pressure under control. I think a good diet, uh, taking your blood pressure medicine when you're supposed to, keeping your blood pressure controlled is as important as a good diet is. And as exercise and resting at least 7 hours a night. Any other comments about the healthiness and the food we eat? This is one of the few articles that does talk about red meat and butter. But anyway. Any other? Okay. Now, this is an article that talks about the fact that daily supplements, people take them, but nobody really necessarily tells their doctor about it, and that some of these supplements can be harmful, particularly if you're already on medication and your doctor doesn't know that you're taking supplements. So this article is against people taking supplements uh, because of the fact that most people that do it, they don't keep the doctor in the loop. And drug-to-drug interactions, negative drug-to-drug interactions still are an issue. Whether you tell your doctor about it or not, you still, so the recommendation is that you not take uh, vitamin supplements without letting your doctor know about it. So if there are drug-to-drug interactions, that this will be accounted for. I know that's not a topic that people discuss very much, but this is an article that suggests that it's an unnecessary and perhaps unhealthy act. Carol?
I think this is a good article because for the longest, I didn't realize that supplements or vitamins were medicines per se. If they say it's a medicine, or instead of saying supplements, maybe you would think about telling your doctor about it. But I never thought that supplements like vitamin C or magnesium or vitamin D was actually something, a drug that you're putting. Is it called a drug or it's just called supplements?
The drug, and I think that the problem is that most people don't consider it as a drug, but it is a drug, and it's a drug that needs to be accounted for, but it generally isn't. John Buchanan?
Talking with my talk. I think a couple of years ago, my doctor, I switched doctors, and he wanted me to bring everything that I take, all of my medicine, all of my supplements, the probiotics, prebiotics, whatever I'm taking, the one a day. I was even taking chlorella, the unicellular algae. I was taking for knee pain, the glucosamine chondroitin, and he took
Yeah,
me off a lot of stuff. And the fish oil, he said, don't take that, don't take that, don't take that, don't take that. So I'm down to a lot less. In fact, I'm not taking any supplements now. It's all medications, recommended by my doctor. So that's the thing. I mean, he told me to bring a box with all the stuff that I take to my to my session, my annual physical. And also, and I think I mentioned last time, I had to make arrangements to get my blood work done before the physical so he could comment on it during our in-person visit. So I think those are two um, plans that really help. And the doctor can, comment and, recommend better ways to deal with stuff. And the sphygmomanometer is also very important to bring in so that they can test it based on the digital ones that they have at the hospital or where you get your physical. Thanks.
Thank you for sharing. I think that's very important information. Uh,
I have a
Carol?
question about all of that.
Yes.
Are the doctors, are they trained when you go through your training, do they talk about supplements and the impact of some of these things that we take over the counter, these vitamins and whatnot? Do they have the research on what they do and don't do that they train or tell the students in medical school? Or is this something they just, since they don't really have the research, they just feel like that's something we shouldn't be taking?
No, uh, I think that we now have more. For example, one of the uh, persons who spoke to us about food as medicine is teaching our medical students so that they will do exactly what John had talked about. So that yes, the medical students of today are being taught about food as medicine and the fact that whatever medication you take, whether it's supplements or what, that the doctor needs to be part of the decision, as well as emphasizing the importance of the food you eat. This is ri- this is the doctors of today, not the doctors of yesterday, but the doctors of today. Carol first, and then Joyce.
Okay. How come everybody congratulates each other? The less medicine you take, they'll say, I'm not on any medication, and everybody applauds, and they might be on vitamins or something. But we encourage, and I think doctors encourage less medication. So we don't think that vitamins or even certain foods are affecting us. So as long as we're taking supplements, we are in a fantastic position. We're not realizing that when we're taking vitamins and supplements that we're also are on medicines. And I don't know if that's good or bad, but I guess the utopia is not to be on anything, right?
Well, I think the ideal is for you to live your life and not need any medications. But the truth of the matter is that as you get older, you have more and more chronic uh, diseases. And as such, uh, it's rare to have somebody who's reaches the age of 80 who's on no medication. And while you may brag about it, I think it's wonderful. But it's also important if you have chronic diseases that they needed to be treated in order for you to live a long life. So that, yes, if you are healthy enough so that you have no chronic ailments and you don't need any medications, that's wonderful. But it's also important if you are older and you have chronic ailments that you take medication that will keep you living. Joyce?
Yes, my doctor has done the same thing that John's doctor asked of him. And I bought all of my medications and everything that I take. Even allergy medication, medication for my eye, the eye drops. And I shared that list that I got from him with my other doctors, especially my GYN and my gastro doctor. And they were very happy that I had that list of all the medications that I was taking. Aspirins, allergy medications, eye drops, anything that I put into my body.
Thank you for sharing. Thank you for sharing. Okay. Uh, we can go to the next article. Aren't any more comments? This is one of the most disturbing articles of all that we have today because what it unmasks is something that we often don't even talk about. When we talk about maternal mortality, it's a subject that is painful uh, because we are hopeful that no mother dies giving birth, but the fact is that many of them do. And what is even more horrifying is what they die from. I mean, I had no idea uh, how important drug overdoses and homicide and suicide and how violent deaths that occur with pregnant women. And we tend not to even include them. We try to talk about all the other reasons why they die when drug overdose and homicide and suicide are a huge part of why we have such an incredibly high maternal mortality rate. My mother died giving birth to me and my twin brother, and so it's been a subject that has always been close to me. Uh, but reading this and uh, reading about all these so-called medical causes, uh, which rarely are discussed, points out that we've got a lot of work to do to talk about what the CDC excludes when homicide and suicide and overdoses is kind of frightening to see these as approximating more than 50% of maternal deaths. Were many of you surprised to see this large number of violent causes of death for maternal mortality? Or was I the only one surprised at the role that violence plays in maternal deaths? Because all of those are factors that need to be dealt with. Lucy?
And these are things that we have been shouting from the rooftops. And the evidence has been there, yet our policies and our fiscal allocations always go in the wrong direction.
What else can we do about it?
This is an important step. When the light is turned on, you can no longer curse the darkness.
Uh, well put. Well put. Oh. Well, let's see. Some people just turn the lights off.
Dr. Callender, about a few months ago, they had articles out about women, Black women, and going to the hospital to have children. And one was a physician, and the hospital turned them away and said they weren't ready yet. And one lady had the baby in the cab leaving the hospital, and how they ignore Black women in particular during that stage. They say, oh, you're not ready, or go home, and not giving them the attention that they need. So hopefully articles like that will make at least the hospitals aware that our women are being turned around, and even for prenatal. If they make aware that we're not receiving the help for a minority, and then start, and people who are doing the research, and articles like this can help them aware so they can seek out and help women to survive.
Yeah, it's clear that a lot of that is kind of buried under the sand. John Buchanan?
Yes, this last couple of paragraphs kind of made me think, what would they give the pregnant women like an interview to determine if they're, had that violence or drug dependency? And would, just think if you were a pregnant woman who was on heroin or something like that, would you tell the doctor that you were on heroin, or that you had a boyfriend that was violent, or a drug dealer? You know what I'm saying? It could put
Yes.
them,
Well, they ask
you
those
know,
questions. Now, whether they tell the truth about it is another story.
oh, you say they do ask those questions now?
Oh, yeah. Yeah, that's part of the
Oh,
history.
okay. Okay.
Yeah, history taking is an important part of the uh, history and physical examination, important part of the determination of everything. And that's why uh, this is so awful that we uh, hide all of this information by just talking about the so-called
Mhm.
medical causes, because these are, to me, causes, whether you want to call them medical or whatever, they're still causes. And as you say, that's all part of the history. 90% of diagnoses that are made are based upon the history and physical examination. Lucy, Dr. Perez?
And you get that information based upon the relationship that you have with your healthcare provider.
That's correct. Yeah. So if you have somebody who has no prenatal care at all, which is often the case for many of these women who are uh, substance abusers and have boyfriends who are violent people. Uh, since they don't have the prenatal care, they go into the emergency room and they may or may not tell their physician about all those factors that are important part of the diagnosis of what's going on. Any other comment? The light's turned on. The question is, are we going to keep the light on, or are we going to turn the light back off?
Keep the light on, shining bright. We got to. We got to. We have to advocate for it. We have to make sure that the doctors that are coming through respect the patients that they're taking care of, that they have models like you, Dr. Callender, to follow. We got to make sure our HBCUs, our Black medical schools have lost considerable amounts of money secondary to this administration. lost brilliant minds. We have got to make sure that there is some type of advocacy for reinstatement of what's happened to us since this administration started.
Well, I think that there's been no scarcity of protests and uh, unmasking and turning the lights on. So we've got to continue to keep the lights on, as you said. And we can't be, as the good book says, can't be weary in well-doing. And keeping the lights on is something that we have to continue to do. And there is a price we pay, but uh, we have to try to be willing to pay the price. Okay, let's go to the next article. Oh no, we're going from bad to worse. Oh yeah, this article was more painful than the previous article. Uh, Laws restricting abortion are linked to a rise in abhorrently high maternal mortality rates. Uh, those of us who've been in medicine for a long time started off in medicine with these abortions and restricting abortions and having medical students die because they got pregnant and had an illegal abortion and got infected and died. And here we are back to the same stuff again. Oh, it hurts. It's painful to see us going back to where we started from uh, 50 years ago. Uh, so that we already know that we have maternal mortality rates that are high, but then to add that the fact that these data is now showing that because we're restricting abortions, that more women are dying, more mothers are dying. So horrible. Lucy, any comment?
Deja vu. Deja vu.
Remember the days?
To remember the days that, and we, it was always because it was women of childbearing age, it was always such a shock. And it doesn't just impact the woman, but the entire family. And it puts unseen burdens on our community in disproportionate ways.
I don't know if people understand what we're talking about because what used to happen in the old days was uh, having an abortion was not something that was thought of as being positive because that meant you were out of wedlock and you had to go and get what was then called an illegal abortion. And they were done in unpopular places and unseemly places and by people who weren't greatly trained. And so as we got to the point where this was cleaned up and the abortions were done in a very clean way and decreased maternal mortality. So now we have back again to the situation where you have more laws that restrict abortions. You have this same problem occurring that abortions now are done in a not so uh, friendly environment, and as a consequence, mothers are dying, and so this is uh, ugly head that is turning up that when abortions were easy to get and were done under ideal circumstances. Maternal mortality from that cause was decreased, but now with the new abortion laws, it's cropping up its ugly head once again. Uh, anyway, it's really horrifying to see it. Anybody not understand what we're talking about because it's affecting. It always was affecting our women more than anybody else, but we're back at it again. Something that maybe only women understand, but
And surveillance, which was, I said, and surveillance, everything associated with many of the abortion laws that are in red states. The surveillance around it. I mean, we talked about um, tracking devices as it relates to women's cycles on their watches and bounties. There are crazy things that are going on now in this country around reproductive rights. And all of, I mean, it was bad back in the day, but I think in many regards it's much worse now. And the divisiveness between the haves and the have-nots is unbelievable.
well, the question is, what can we do about it? What can you do about
Vote,
it?
vote, educate, advocate, keep the light on, talk about it. It's a posture that we must have. And many women were not only, many women wanted the option of whether to have a child, whether they were married or not. The economic and mental burden of the pregnancy impacted our community significantly. And we had reached a maturity in how we discussed it as women. And so much of that is lost to a younger generation. I know Dr. Height with the white gloves women could sit down and have a discussion about reproductive rights, which not only impacted this country, but had a global impact. Because the respectable women were having the discussion. And it was not only relegated to those who were considered marginalized.
Okay. All right. Well, I think that groups like this need to proliferate, and so we can educate and empower more and more. I mean, that's one of the solutions. Okay. Any other discussion? If not, I guess we can move on to a more palatable area. Well, this is a positive thing. So, uh, okay, Joyce, take care. We'll miss you. Um, this is a situation with the psychological, the medical, the dementia related, and the interdisciplinary teams actually made a tremendous difference and health and economic benefits for people with savings of as much as $48,000 per person, which pointed pointed out to the importance of teams working together, led by a dementia specialist. Uh, Particularly becomes important as you have aged persons involved. And they talk about people age around 71 years of age. And this collaboration made a big difference, including the use of drugs that were used to address dementia. And so what it's saying is that when you have interdisciplinary team led by dementia experts and including other interdisciplinary team members, the psychologists, the sociologists, that it makes a big difference in the results. And as we get more and more medications that actually are effective at delaying the progression of dementia, will make an even more economic benefit. But this is one of the first studies that has demonstrated the positive impact of having a team approach to led by a dementia expert uh, and associated with psychologists as well. Uh, and this made a big difference. So I thought that's positive news. We've had some disturbing negative news, but this is positive news. Any comment? If not, let's go to the next article. This is an interesting article. It talks about the fact that with COVID, uh, depression was at an all-time high, particularly in the teenage population and people of color. And after after COVID, the depression seemed to decrease, suggesting that COVID was an incredible source of depression particularly for the younger population, and that after COVID, uh, mental health improved and continues to improve, which is some good news. Uh, the question is, how can we sustain it? It was interesting because prior to COVID, mental issues weren't as desperate as they were in the people of color, particularly the younger people of color. But when COVID came on, it impacted negatively the younger people of color more than anybody else. And so to know that we're moving away from the poor mental health is a positive sign. The role that anxiety and depression play in our mental health uh, is pretty measurable and is pretty potent. And so I think this is good for us to know that mental health can be improved. And how do we sustain it? That's the question.
Vote.
Any other comments about depression and the fact that it's getting better, although it's still uh, anxiety and depression still play a major role in mental health illnesses. Let's go to the next article then if there's no comments. It's an article that is an article for the day. Is artificial intelligence better than radiologists at interpreting mammograms? And one of the things that is very clear is that there is a role for the artificial intelligence along with the radiologist to make the reading of mammograms the best it can be. So I think that it's not, is AI better than radiologists, but can AI and radiologists together give the optimal reading of mammography? And the answer would be yes. Together, they're better than either one alone uh, because the human sensitivity is important. So yes, when you looked at all the different studies, the AI alone was better than the radiologist alone, but together there was a synergism that was unbeatable. And so I think that's the way it should be meant to be, that you have the mammographer and the AI together giving the patient the best result. And I think that's the moral of this particular story. And this, while true for mammography, is equally true for pathology and for the other disciplines as well. That together, the AI combined with the scientists can give you the results that are ideal for the patient. And so, to me, it's not one or the other, it's the combination which together results in the best results for the patient. Any comments or questions about the conclusion we've drawn and shared? Anybody have a agreement or disagreement? Dr. Perez, any comment?
No, none other than making sure that there is diversity, equity, and inclusion in this intersection between human and AI knowledge.
Very important, very important combination. You're right. Yeah. Okay. I think that's is that the last article? No. Oh, this one. Oh, yes. We've talked recently about the impact of obesity and the fact that it is a disease, and that you like any other disease entity, there's a price you pay for it, and a high risk for severe infection is something that goes along with being overweight, and look at the number of people that were involved in the study to show that it's more than a notion. Uh, People with obesity are 70% more likely to get infections that lead to hospitalization or death. So uh, it hurts not to be uh, it hurts to be obese in terms of many ways, and one of the ways we tend not to think about is the fact that you have more infections than anybody else because it's an inflammatory state. Uh, Obesity is an inflammatory situation that is associated with uh, interleukin-6 and other metrics that identify. And these metrics predispose you to getting infections, which can lead to your death. So it's important to try to stay as healthy as possible and try uh, not to be obese. Any comments or questions about the uh, price you pay for being obese? We talked last time about the Dr. Brass.
I think we have to say the price we all pay for being obese and put the public health component included in how we address it. Yes, it's individual behavior, but so much of it is learned behavior and community dependent. So there is a significant public health component. And we had a discussion last week about our mindset and how we see obesity and how we expect to see obesity included as it relates to our entertainment, even our sports. I know he appeared to be overweight. Catcher, who was playing against the Dodgers in the World Series, and obesity plays into so many components of our life and how we feel about it. Even though we appreciate intellectually that it is a disease, has a lot to do with its impact on our modeling behavior. I hope you follow what I mean. We discussed whether we should see obese people in commercials, whether the commercial was talking about obesity or not. Just issues of inclusion, just how we think about it.
It's a very interesting discussion, and there's an article that may be included, which talks about the relationship of obesity to sleeping habits and eating habits, binge eating as well as sleeping habits. And all of those things can be in many ways related because they talked about the fact that if you don't get 7 hours of sleep, that your ghrelin levels and your leptin levels are such that you're going to eat more. And of course, you eat more, you gain more. And so there's an association of sleep and binge eating and all those things together uh, uh, get to somebody who is, and this is the article, thank you. And the link between that and seems to be sleeping, disrupted sleep patterns. And so the binge eating and sleep patterns seem to be associated. And so it's not just one item. It's not just eating. It's sleeping, eating, and other things. How the interaction of not getting enough sleep can trigger many other things that will lead to you being overweight. And this, as you mentioned, the negativity of shaming and the importance of having people of all kinds in commercials, uh, uh, not making it appear as though being overweight is wonderful, but being overweight is a disease that occurs in people, and therefore, uh, being inclusive, we have to have people who are normal weight as well as overweight people. But recognizing that being overweight is a disease process. Anyway, so that this is important to look at the many ways in which overeating may be related to your sleep patterns, and how your sleep patterns may be related to overeating, and back and forth. Any comments on this association? I think this is the last article for us. So, any closing comments? Any thoughts about what we've talked about today? And
I love the discussions. I so appreciate everybody's candor and transparency.
well, I just hope that people hear and understand the many points of view, and the fact that we have them, and we must share them and educate and empower as many as we can, so they become part of the protesting and advocating group that tries to get us to have as healthy a situation as possible. And when the administration wants to do the wrong thing, we can prod them to do the right thing. And when they're doing the right thing, we should let them know that we're happy that they're doing the right thing. We're doing the wrong thing, let them know that we're unhappy about them doing the wrong thing. So I think we have a responsibility, and the fact that we have a group like this suggests that in some ways, if we can get it to proliferate, it may make a difference for all. And that's really the message of the day. Carol, any closing comments?
I'm doing fine. Janice, how you doing? So I'm measuring myself by you. I can't hear you.
You're muted.
Janice, you're muted.
I was saying that it's good. It's day by day, ups and downs. This past weekend, a little different. Valentine's Day weekend. I was married February 14, 1970. And then in 2020, February, we had been planning our 50th wedding anniversary. And he had been working on it for months, almost a year, with, of course, Dr. Callender's friend, Dr. Robinson. And he had a checkup. And the checkup said, go to the doctor. I think it's something wrong with your heart. Things changed. It's different. It's different. Talking it through, call me sometime. It's good.
It's amazing what we've all learned about grief since then.
Yes.
Yeah.
Dr. Callender was a big help with me and with the kids, as you saw when CJ chimed in the last time we were all together. And I said, okay, I better explain this. Hey man, how you doing? Good to see you. You look good. And I had to say, he's family. Dr. Callender's family. And Carol, for you, what helped me was having people around, um, just talking, nothing negative, and I hate the tears, so it helps.
Oh, so do I.
Yeah.
So let's not talk about it.
All right. Okay. Well, it's a cloudy day today, so are your children going to be able to track you today? You running out?
Well, thank you everyone for being with
Yeah.
us and making it such a delightful day. And God willing, see you next week.